Education, health, and housing are the basic needs of any human living in a civilized society. And unfortunately, every year more than 60 million people in India face poverty simply because a large part of their income is spent on one of these needs: health. In a modern democratic country, it is expected that the government should provide for these basic needs that help a citizen lead a dignified life. But year after year, this expectation has remained only that, an expectation that is never fulfilled. In India, the government spends more than 51,000 rupees annually on the health of a member of parliament, while the annual expenditure on the health of a common citizen is mere 1,800 rupees. In the report of National Health Accounts released by the Ministry of Health, information about the expenditure on health in 2018-19 has been given. It details how much the central and the state governments have spent on health in 2018-19. In 2018-19, more than rupees 5,96,000 crore was spent on health. Out of this, 2,42,000 crore was spent by the central and state governments. The rest of the expenses were borne by the people themselves or by private institutions. Simply put, in India, the government spends only 5 rupees per day for the treatment of a person. It can also be understood that if the government is spending a rupee on your health, then 29 rupees are being spent on the health of an MP. In 2013-14, the government spent 1,042 rupees on the health of a person in a year. In 2017-18, only 1.35% of GDP was spent on health. According to WHO, Bhutan spends 2.65% of its GDP, while Sri Lanka spends 2%, which means our smaller neighbors spend more than us on health. In the report of National Health Accounts 2014-15, it was said that the government should spend at least 5% of GDP on health, so that people's expenses can be reduced. But India has set a target of spending 2.5% of GDP on health by 2025, and be mindful of the fact that this is in the post-COVID world. The lower the out-of-pocket expenditure for the citizen on health, the better it is. This is because it is understood that government health facilities are reaching the people. But in India, there is still a lot of work to be done about this. In fact, lack of medical help is a reason that people are compelled to die by suicide due to illness. According to the report of the National Crime Records Bureau, illness was the second major reason for death by suicide in 2021. 30,446 people died by suicide due to illness in 2021. Do tell us what you think about the video in the comments section, and for more news updates, subscribe to India Today.